introduction. We'll directly get into the meeting today. Thanks everyone for joining this call, and my apologies for the blip earlier. I would put this conversation to a very simple, in very simple words. Doc and I, Dr. Darrell DeMello, have been chatting up on the fact that there is a lot of what we call as fear mongering that happens around that's happening around COVID. A lot of that is myth, and a couple of things which are important for all of us to look at. But in the whole the amount of information that each one of us gets through multiple social media and places makes it really difficult for us to judge between what is right, what is wrong, what's believable and what's not. Which is where when we requested Dr. DeMello, with his experience of about 6,000 COVID cases and moving and increasing, at this point in time, it was best to hear it from him. What are some of the myths that we are dealing with, and what are things that one needs to really care about, take care of? A couple of quick ones before we get started. Please feel free to ask a question. I will open the session for questions, and feel free to add those questions in the chat window. Another thing, it's not a sponsored event. It's an event between friends and family across. So, as I requested earlier, feel free to bring in some of your family members, because I and Dr. DeMello firmly believe that this is not something which can necessarily only spread with all of us reading it from our WhatsApp messages. Some of this needs to come in more free flow and based on personal interaction. So I'll stop here, but more importantly, Dr. DeMello, if I can request you to start this whole conversation with our first thing in mind. What are the myths? What are the top 3 most important myths that you've really come across around COVID? And I'm talking from the WhatsApp University and so many other universities that are flying around. What are the 3 most important COVID myths that you want to break today?
Good evening, everyone, and welcome to this session. Ashish and I have been working on this and planning something like this, where we talk about some basic ideas about what I've learned over the last year and a half with COVID, having treated 6,000 plus cases as of the last April, and those numbers keep increasing. Fortunately, the numbers are starting to go down across the country, which is real good news for all of us. The biggest myth is that, I won't get COVID. Every one of you is going to get COVID. Every one of us is going to get COVID. I've already had my COVID. I didn't know when I had it. My antibodies are positive. All I've seen is an increase in antibodies over the last 4 months. My Christmas gift was to come antibody positive. So bear in mind, every one of us are going to get COVID. Be prepared to fortify your body to get COVID. It's going to happen over the next 2 years. You can't run. You can't hide from COVID. Somebody in your family is going to get it, you're going to get it. Somebody in your friend circle is going to get it, you're going to get it. That's the biggest myth I'm going to lay out on the table. The second big myth is the fact that precautions. All the stories of, if I have COVID, my loved one should be away, and we go to another place, go to another house, go to my in-laws' place. That's another myth. The minute you send your wife or your children or your mother or your father to another house where there's more people, all you're doing is transferring virus from here to there. You're increasing the spread. Okay. Last year, the virus was less transmissible. This year, the new variants we're seeing are extremely transmissible. I'm actually seeing families who get together for dinner one night, all families are sick. 16 members of the family, 18 members of the family, 27 members of the family, all sick with COVID, all tested COVID positive. So let's think that we need to still restrict ourselves and be careful about what happens. Okay. The other myths that I have is, he's got it, my husband got it, so I will not have it. The answer is no. If you're living in the same room, You're sleeping on the same bed as a husband and wife. Or if you're eating at the same table, living in the same house, the same home, with your mom, dad, brother, sister, cousin, whatever, extended family, small family, big family, the virus is already being spread. Okay? So treating the whole family becomes paramount in this. Not just treating the patient who is symptomatic or patient who is positive. The other big myth is, oh no, I'll wait till my RT-PCR test is done. RT-PCR test, by the time it comes positive, even on a normal day, normally I say do the RT-PCR test on day 4, day 5, or day 6 of symptoms come positive. Clinically, if I tell you you're positive, please start treatment on the spot. Do not wait. Do not wait to go further because you're going to just waste time. This is a 14-day disease. The first 4 days are the best days to come for treatment. The next 3 days are less best to come for treatment. Day 8, 9, and 10 are the worst days of this disease. It's the clotting days. It's the days when your lungs will clot up. Your lungs, your brain, your heart can clot up. When I say clotting, this is a clotting disease. This is not a viral disease. The other big myth is this is not a pneumonia. I get standard responses from doctors, from patients. Oh, I had an infection, a pneumonia infection. No, sir. You have a clotting disease. Take the precaution to prevent your clotting now. But if you don't and you start clotting, you can accelerate your clotting pretty fast. I've seen people on day 7 be at 7 by 25 or 5 by 25 on the HRCT, on the CT scan, the severity score. On day 10, they're 23 by 25. Don't fool with this disease. You could be dead on day 11 or 12. And I'm not joking when I say this. I've seen patients, we've had experiences. I've had somebody who sat with me right behind me where I'm sitting today on the couch. I had put my hand around this young lady, 35-year-old lady, who tested negative 3 times in 10 days. Came to me with an oxygen saturation ratio of 85. When I tested her, she was 86. Okay, I didn't know what a CT score, a severity score on a CT scan was. And one look at a CT scan, I told her this is a plus 15. You have clotting of at least 15 by 25. 15 by 25 means 60% of your lung is already clotted. So when her actual report came, and mind you, she had increased her SpO2. In the 2 hours she sat. When she went home, it was 92, 93. Her report came in at about 10:30 in the night. When I got her report, it was 20 by 25. I wasn't going to take a risk of keeping a young lady at home and letting her die overnight or 2 days later at home. So I moved her to a hospital, a well-known hospital in Bombay. She died a day and a half later of a sudden heart attack. A young kid, 35-year-old lady. Okay, so this is how it is. Don't fool with this disease. You can get accelerated very fast. Another thing I'm seeing, another observation I'm seeing, is that and I'll go back to myths a little later. The combination of favipiravir and the combination of medrol or solimedrol or methylprednisolone seems to be accelerating the clotting. Whoever's writing these drugs, be careful of look at your drugs and find out when you're getting, what you're getting, why you're getting. Ask that doctor, why is he giving all this? Because when you start steroids on day 1, 2, 3, 4, steroids like medrol or methylprednisolone will suppress your body's ability to fight the virus. Okay? Normally, your body can fight this virus properly by day 8 and kill the virus. But because when we start, the viremia is very high. And when we end up on day 7 or 8, the viremia has come down and the inflammation has gone up. That's where the clotting disease starts. Okay, so there's a crossover on day 7 to day 8, which you have to be careful about. Okay, so that's the simple thing about clotting. Now, when you give medrol or methylprednisolone, and I'm seeing doctors across the country give this. When you give medrol day 1, 2, 3, 4, 5, you're reducing the body's ability to kill that virus. You're giving favipiravir thinking that the virus is being taken care of. Responses, there's something happening in the body, and I still don't understand what is happening. why the body is accelerating the clotting. Because I'm seeing patients on day 8 with 20 by 25, 70 by 25 CT scan scores. So be careful when you get such prescriptions. I've seen prescriptions with 20 drugs, 13 drugs, 14 drugs, 16 drugs, all not required. You need a very simple, basic thing of a 3-drug approach, a 3-armed approach. Anti-inflammation, because this is an inflammatory disease. Antiviral, kill the virus if you can. And anti-clotting, to reduce the clotting. It's a very simple disease to treat if the doctor knows what he's doing. So be careful of all this, okay? What are the other myths we have? Let me just check our notes. 1 second. The other one are, I'm going to break some other myths. Being isolated in the room for 14 days, 17 days, 27 days. If families want the loved one, the family member to stay away from them for 27 days, no chance. Without ivermectin treatment, without an antiviral treatment, I've told patients to get out of the room on day 9. I did that yesterday. I went to somebody's home and brought everybody out of the room. First of all, the lights were off. The AC was off. They were burning in the heat. I said, get out, come and sit down in the hall with me. By the time I left their house in an hour, everybody was smiling. They had red faces, happiness. That's what I want to see. I want to see happiness. Okay? Because the emotional element in this is pretty high. The fear, the paranoia people have is very high. So if you take ivermectin, if you take the ivermectin the way I give it to you, one day, 24 hours after the ivermectin dose of 2 days, you can actually rejoin your family and still be happy about it. You cannot, as a patient, you cannot reinfect anybody else. If I was wrong, 6,000 families would have come after me. Okay, so I've been doing this from May last year, and I've been probably right in this because I have a pretty good database. I have 6,000 patients and about 30,000 family members. I have a lot of patients to talk about. So when I look at my data, now let's talk about food. Foodstuffs coming in, vegetables coming in, parcels coming in. The virus doesn't survive for more than 3 seconds, 4 seconds, 10 seconds. So all the stories last year which we wrote, I wrote some of those SOPs, some of those warnings of not to do this and not to do that and all that's history. You can open your parcel, let it come in immediately. The virus doesn't survive for more than a few seconds. Okay. Same thing with formats, tables, chairs. The virus does not survive on that. Where you get infected is face to face. That's why your mask, the double masking, is very important. Double masking is one of the surest signs of protection that you can have if you're not protected. Okay, so be careful. The double masking is very, very important. Hand washing, soap and water is the next one. I see a lot of sanitizers being used, and I see a lot of skin irritations happen. So sanitizers are good to have when you're in an office or in a place when you can't wash your hands. When you're at home or in an office or wherever you can wash your hands, soap and water, please go ahead and do it. Okay. Ashish, you want to talk about any of the other myths? Any question that I can go on, or can I just roll on and talk about COVID in general?
Doc, something which is a segue to what you've just talked about is the precautions a family needs to take when they're treating an in-house patient. You're obviously quarantining someone in the house. What are some of the things, the do's and don'ts there?
The do's and don'ts for somebody who's quarantined and somebody, the rest of the family members is please make sure that you are masked up if you're going into the room. You can go into the room. The chance of getting infected is pretty low. Okay, the person in the room, cheer him up. You go and check him out, especially when you have to give injections. You have to, and I normally ask the family member to give the injection. Some injections have to be given. But I ask the family member to make sure they can go on mask as long as it's before day 9. After day 9, I don't care. You're not going to get infected from anyone. Okay. After day 9, from the onset of symptoms, you will not have a problem. Okay, so don't worry about that. The other family members, watch for your symptoms. Watch for your own symptoms. If you have symptoms, please talk to us about it. I'll give you treatment. I treat the whole family. I do not treat only the patient. I will ask for details. I give you a very simple questionnaire. I will ask for details. I end up treating the whole family. I use the word, I use one word, which is sanitizing the whole family. It's very clear that my goal is to keep everybody safe. Okay, so that's pretty simple to do. Yeah, Ashish, and other things.
Doc, one thing that's coming up, and that's obviously a little concerning as well, is the fact that how are we going to manage this for kids? Now, amongst kids, at this point in time, it was really a perception that kids probably are not going to have a heavy infection. It's going to be a mild infection. It's going to pass on. But with all this data coming around, the third wave, first of all, we don't know what that third wave is. But assuming there is a third wave, and maybe the logic being that the third wave is perhaps where there may not be enough vaccination clearly available, and as a result, the third wave could be more targeted towards more vulnerable lot, which is essentially kids. What is the element of truth there?
Okay. Let me take that question on. Let's talk about children. I've actually seen children infected from day one. From May last year when I started treatment, I've seen children. The youngest child I've treated is 3 days old through breast milk of his mother. Okay. The oldest child is like 15 years, 14 years, 12 years, 10 years. Here's a theory that I've had, and it seemed to have been are like green forests. For them to get COVID and burn down with COVID is very, very rare. I have not seen most children. I have not seen them have major problems with COVID. I have seen red toes. I've seen skin manifestation of COVID. I've seen fever with children. It goes away in 2-3 days. I've never seen clotting in the lung like the way you see in adults. I've never seen that. So I'm going to say this third wave is another media-driven psyche, negative psychology to try and put fear into the population, because a lot of us have got confident. I'm a different person today than what I was last year. Okay, when I started treating, I was very different, very worried, very scared. Today, I don't care. I've stopped caring since September. When I realized that whatever I'd done seemed to have worked and worked well, I started going to people's homes, started seeing their patients at home, in my home clinic, everything. And the chance of getting infected, if you are well protected, if you're well fortified, the chance of you burning down is very rare. And I used this. I stood in the lobby of a 5-star hotel in Bombay, and I asked all the staff. We had an all-staff meeting. I asked the staff a question: if I light a fire in this hotel right in the lobby and burn it down, will the hotel burn down? The answer is no chance. And I asked why, because there's enough of fire retardant built in the system. And so I said, that's exactly what I want to do to your bodies so you don't burn down. And boy, we haven't had a case in many, many months in that hotel. So there are ways and means of protecting yourself. The commonest way to protect yourself is to up your vitamin D. All those who are adults, or all those who are above the age of 10, you need to really make sure your vitamin D levels are greater than 60, less than 100. I've had patients who come to me after the 30 days with 392 antibodies, with 270 antibodies, with 350 antibodies. But they had no clinical symptoms. The symptoms were pretty much an autopilot. Yeah, they had mild symptoms the first 4 days, but it went through. When we checked their vitamin D, it was very high. It was 95, 94, 90, 89. So vitamin D is one of the drugs to support you and prevent you from getting COVID. Prevent you from getting a bad attack of COVID. Whatever you do, try and up your vitamin D things from a protection perspective. The biggest myth is taking Zincovit or zinc tablets, taking vitamin C, Kada. I joke with patients, सब लेने के बाद ना कोविड हो गए, अभी चुप करो, दवाई ले लो अभी, वो सब बंद करो. Okay, I'm very clear with patients. Do not take something that I'm not aware of. Because if something happens to you and I'm not aware of it, you start bleeding or something happens. Because I know what the drugs I give you will do to you. I do not know what you're taking if you're taking something I'm not aware of. So I'm very clear with patients on how to handle that. So be careful with what you're taking. All the myths of taking all the kinds of so-called immunity boosters doesn't work. Don't waste your money on it. Though that is classic WhatsApp university. I used to get all kinds of stuff every day, all promotional material for different things every day. It doesn't work. The only thing that works to support you, protect you, is vitamin D. You cannot take the injection, cannot do the orals. Go out and stand in the sunlight for 1 hour. 7:30 to 8:30 in the morning is the best time to go and stand. I've had a 91-year-old lady whose granddaughter had COVID. The whole family came COVID antibody positive, including her. She had antibodies of 90. Guess how much her vitamin D level was? 89. It's fascinating to see how she didn't have a thing. Now, her habit, and when I asked her daughter, who happens to be 3 years my senior, I said, tell me what happened here. She said, my mom sits on the balcony every day religiously. She's been sitting for years. She sits in the sun, enjoys the morning sun for 1 hour, and that's what's protected. So I'm sharing with you experiences that I've had over the years. COVID is not a bad disease. It's not a killer disease. It's a very easy disease. When I'm going to talk about days 1 to 14, I divide COVID into 2 weeks, week 1 and week 2. Week 2 is the critical part. Week 1 is the build up to the tsunami, to the storm, to the cytokine storm. So if you come week 1, 2, 3, 4, I can put you on treatment which will keep you cool, calm, not reactive, not overreactive. So it won't burn you down. Because COVID is a virus. That's a terrorist that comes into your body, multiplies pretty rapidly 5 days beforehand. Okay, and I'll talk about another bit little after this about the virus. Multiplies very rapidly, and when it multiplies in your body suddenly realizes there's a stranger here, there's a foreigner here, there's an outsider here, there's a terrorist here, I need to overreact. The body goes into a super overdrive. That overdrive is so big, it's like a tsunami. It's called the cytokine storm. That cytokine storm sets off the clotting cascade. So clotting occurs between days 7, 8, and 9, okay, and 10. And you can be dead by day 11. I'm not joking when I say this. Let's talk about the virus. I keep hearing statement, oh, when I got my symptoms, I isolated myself so everybody else is safe. When I start talking to people that you've been infected for at least 5.2 days, because the median time to incubation is 5.2 days. Okay, well, I normally work on a 4-day, 6-day time frame of infection. So if you've been infected and you've proven and you got symptoms, now moving your family away, now isolating yourself is really not going to help them. It can make them get less virus, but I mean that's the biggest myth that I want to expose. That if you think that you've been harboring the virus yourself and you're not breathing fire out, breathing viruses out to the whole world around, forget it. The common places to get sickness or get COVID are grocery stores. They're closed environments. They're very, very closed environments. And who knows in that grocery store who's infected? And that's life. Okay. Ashish, next thing you want me to talk about?
Yeah. So, Doc, we'll talk. I mean, there are a lot of questions which are coming in as well, but there are two topics which I want you to sort of look at, and then we'll open it for other questions. One is around the post-COVID symptoms and post-COVID scenarios and how do you deal with that. And the other topic is the favorite topic for everyone, vaccination. Let me start with vaccination first. I heard someone saying COVID is the best vaccine for COVID, right? If you get COVID, automatically post-COVID, chances are that you may have more immunity or your antibodies are built enough to give you enough rigor. How do you react to that? And more importantly, there are a lot of other things also attached to it. If I'm infected with COVID, what is the minimum amount of time that I need to wait to get my vaccine done? So a couple of these pointers if you could touch upon.
Let's talk about COVID, the natural infection versus an artificial infection from the vaccine. COVID, getting immunity, natural immunity from natural infection is, in my view, 1,000 times better than getting it from an artificial source. I use an example in Bombay. For those of you who are aware of Bombay, we have two ends of Bombay, Pedder Road or South Bombay, where prices are sky high, and Virar. Okay, I always ask people, if you were offered a free bungalow, free flat, where would you pick in Pedder Road? Would you turn around and say, no, I don't want it, I want it at Virar? Okay, I get the standard answer. No, I prefer at Federal, not Virat. So I liken South Bombay to getting the natural infection in a controlled manner. Okay, vaccination is there to reduce the severity of disease in patients who've had the two vaccines, who built up enough time. What we are seeing is people who go for the first dose come back with infection 7 days later. People who go for the second dose come back with infection, within 7 days after that, with straight COVID. Now, here's the rule that I personally apply to my patients. I apply to, and this is based on data. It's not based on some whims and fancies. If you've had natural infection COVID, you honestly don't need the vaccine. Always do a COVID antibody blood test. Check it before you go for the vaccine. Number one. Number two, if you've had the first dose of vaccine, okay, and you've had natural COVID, you do not need the second dose of vaccine. There's a paper from the US. I don't know if it's a JAMA paper. There's a paper I've seen which says you do not need the second dose. Okay, so those are the two things. For those who are high risk, for those who are unprotected, for those who have to go out to work, whether you're 18 years old or whether you're 70 years old, if you have no natural infection, you're likely to get sick, take the vaccine. I'm clear about that. I advise people to take the vaccine. Now, people ask me, which vaccine should I take? Honestly, it doesn't matter. Take some vaccine that protects you, at least to some extent. We want your severity of disease to be reduced. The best vaccine, in my view, is vitamin D. Go out and build up your vitamin D as high as possible, up to 90. But in a controlled manner, you will not get a bad attack of COVID. My COVID, I got December 26 last year, picked up by a routine COVID antibody blood test. It started at 1.6. My last COVID antibody blood test, which was last Sunday, my COVID antibodies were 10.8. It doesn't matter what your amounts are, as long as you've had the infection, whether you're 392, 250, or 1.6, as long as you've had the natural infection, the system is now used to the COVID virus and is used to fighting the COVID virus. So that's my views on vaccination, immunity, immunization, and general life with thing. Okay. So if you are unprotected, please go take the vaccine. Okay. If you've had COVID, in the last 1 year, you do not need to take the vaccine at least for a year. Okay. The reason I'm saying this is because I track data out of the US, particularly Boston, Seattle, California, New York, New Jersey, which had COVID in December, January of last year. We are now 16 months or more from that time. There hasn't been a single episode of reinfection. I track data from Italy. I won't never make these statements if I'm not sure of what I'm talking about. Today, I tell people you have a minimum protection of 1 year, probably as much as 16 months. And that can change as time goes on. As long as we don't have reinfection, we can talk about that. From my own practice, I have a clear split of 3,000 plus patients for last year from May to December and 3,000 patients this year. The funny part is between February 15th and April 30th, I did almost 2,000 cases in that time frame. That was a lot of cases to do. Okay, so COVID, if you minimum is from my data. Okay, from my cases, I've never had a reinfection from any of my patients. And I'll tell you, when I treat patients, I tend to build. I always joke with them, I'm going to be part of your family for minimum 14 days. Whether you like me or don't like me, follow what I'm saying. If you don't like me, go to somebody else. If you like me, stay with me. That relationship becomes very personal. I become part. And if they ever have a problem, they'll come back to me. They will come back to me and tell me what's happening. So for me, I have pretty good insight into most patients and what happens in their families, because I'm always talking to my patients or talking to their relatives or talking to somebody. But when you treat one person, there are other people in the family, other extended members of the family, cousins, uncles, aunts, everybody comes to you as patients. So it's a very interesting dynamic I have with patients. Ashish?
Thanks, Doc. Doc, one more question I'm going to ask, and that is something which is a little, I mean, you and I have spoken about it, and I was quite taken aback when I heard your views about it. See, for a lot of people, who have faced death because of COVID in the family, it's been difficult to get that closure. And the reason also has been, unfortunately, the fact that if someone has gone through it, we generally don't get to see the person, the dead body. It's been difficult to also have any kind of an interaction. And obviously, that essentially is what I meant by having a closure around. I heard your views in terms of what is the chances of getting infection from a dead body. If you would want to share a little bit about that.
Okay. The virus survives on a live body. The virus has to enter somebody's cell, a live cell, to grow. It needs certain inputs to grow. In a dead body, all that cellular activity stops. The virus cannot survive for more than a few seconds, a few minutes. So in the dead body, once that body is dead, there's no material in that body to feed the virus for the virus to replicate and grow. Okay, that's number one. Number two, death usually occurs much after 8 days. Okay, much after the body is taking care of the virus. So both ways, there's no chance of the dead body giving you a virus, giving you an infection. And that's something I think whoever can influence the government, we need to start talking to the government to change that policy of putting that body in a body bag and nobody can see their loved one and it goes straight into the cremation or burial ground or whatever it may be. That's something we should change because there's no chance of a dead body infecting you. Where you get the infection is from people around you. The people who are around you, who are family, friends, who are carrying the virus, who may be asymptomatic, they're the people who infect you. It's not the dead body. And I've been a vocal advocate of this. Unfortunately, I don't have the political or government clout to influence government policy on this. So whoever can help out, I'm happy to support that with an argument that makes sense. What I'm saying is very logical. Unless it's a live body, the virus cannot survive. Okay, the virus cannot survive in a coffin. It cannot survive on your clothes. It cannot survive on things for more than a few seconds. Forget about hours and days. It's not going to happen. Okay.
Thanks, Doc. Doc, we're about halfway mark on this session. I'll open the session now for some questions from the participants. We have two people raising their hands, and then I'll read out some of the questions which I've got on the chat as well. Peter, if I can request you to switch on your video and share your questions, and then we'll go to Shashi as well after that.
Hi, Ashish. Thank you for holding this Zoom meeting. Absolutely brilliant. And good to see you, Doctor. I know you helped me through my vitamin D last year. And for the participants, I'm actually calling from the UK. And Dr. D advised me to take vitamin D from, I think, September last year. And as everybody knows, in England, we don't get the sun. So we have to do oral vitamin D. I didn't have the pleasure of sitting, on the balcony at 8:30 in the morning. But, with vitamin D, without his advice, I wouldn't be talking to you guys today. I was tested positive on the 1st of January, so that was my Happy New Year. And, we've done various tests through the doctors here. And some of the doctors here, they don't understand COVID. And, I've gone through Dr. DeMello's regime. He's advised me what to do. Only one question, Doc, is on long haul post-COVID, the symptoms. We're still having a lot of my colleagues and myself, we're still getting, leg aches, brain fog, loads of symptoms, where for 3 or 4 days I'm absolutely brilliant, but the 5th day I'm like can't move at all. Any advice on that? And a further question where now I won't say the variant from India is here, but the variant has arrived in the UK, and we are now concerned about the black fungus. So just two questions. Long haul COVID, any remedies? and how do we avoid black fungus if we are not hospitalized?
Okay. Let's talk about your first part, the first part of your question. Peter, the problem in the West, and the challenge the West has, why they have long hauls is they do not treat the patients from day one. In India, we have the ability to treat patients from day one. I treat patients aggressively from day one. Day one means whether it's 1, 2, 3, 4, 5, 6, 7, 8. I treat them actively. Even if they come to me day 14 and they're still alive and not clotted up, I'll treat them. You know, whether it's cleaning up the lungs or cleaning up the brain or cleaning up the clotting in the body, we can do that here. Very flexible. We have a very easy system to work with in India. A really easy system. In the UK or the West, any of the countries in the West, the US, Canada, UK, that system of saying you will do this only to the doctor is restricting your ability. Here, I mean, I'll say this openly. Most doctors do not know what real COVID is. They do not understand. I have this argument every day with people. Doctors tell me that this COVID is a lung disease. It's an interstitial lung disease. And my response to them, this is an inflammatory disease which is causing clotting. So you've got to treat your clotting first before you go to it. You've got to look at the big elephant in the room, which is clotting. Okay. So for me, that's one of the issues why we are having success and not having long haul COVID. I still haven't seen a plus 6 months long haul COVID in India. And that's an interesting comment for me to make, because in India last year, in April, May, June, July, a lot of doctors just gave patients paracetamol and vitamins and did nothing for them. Many of those patients survived, changed, got better, and they still haven't had long-term COVID. Now, that's one comment I can make. I treat a lot of short-haul COVID, somebody between 1 month and 6 months. Okay, it takes time. It takes 2 months to treat somebody who's come to you at 1 month or 1.5 months. It takes 2 months to 3 months to really treat them and clean the lungs. If it is my own patient, I've had success with 15 by 25 HRCT scan to 0 in 1 month. Okay, I've had success with a 17 by 25 HRCT scan, brought her to 0 in 1 month. I've had success with patients who come with 10 by 25, 15 by 25, 18 by 25. It takes me 3 months if it's somebody else's patient. But yes, it can be cleaned up. Unfortunately, in the UK, I can't do that because I'm not licensed there. Whatever drugs we sent you was sent on a friendly basis to help treat you. But if you were here, the treatment would have been very different. So that's one of the issues. What was the second point, Peter? Just remind me on the second point. The black fungus.
The black fungus.
Black
is
fungus.
it?
Okay.
Yeah, is it?
Here's the.
Go on.
I don't think you guys are going to get the black fungus. What I'm seeing is a massive indiscriminate usage of a steroid called methylprednisolone. In the UK, you guys use a lot of dexamethasone. Okay, dexamethasone seems to have a lesser effect on the causation of black fungus. That's one point. I'm also seeing a combination of methylprednisolone and favipiravir cause not only clotting but may contribute to this. We've seen a huge rise in zinc. Okay, one of the things that's going the rounds is, could zinc be the cause of the problems? I don't have an answer. All I'm doing is I'm just responding to what I understand of zinc and what I've learned about zinc. Zinc is good, but excessive use of zinc can cause things like black fungus. Okay, what is black fungus? It's mold. It's black mold. You get it in your bathroom. You get it in your kitchen. You get it all over. It's around you everywhere. So who does it affect? It affects the immune compromised people. So steroids, methylprednisolone at the dosages I'm seeing of 32 milligram BD twice a day. That's very high dosage of a steroid. And you don't need such a high dosage of steroid. So that's something that in your case, I personally don't think you're going to have black fungus. Now, even in your administrative oxygen, one of the things that we've speculated about, and I'm also been part of the thing of speculation, the administrative oxygen needs a cup. That cup has to have water to bubble it through for it to go into your nose. Okay. Many times that water that's used is tap water, unhygienic water. It's not distilled water. It's not distilled water. It's not bottled water. I've told people use the bottled water and see if you make a difference. The cost is peanuts. I think it's more just the habit of going to the tap and pouring water and doing it. So that's again in your case that may not happen because your people will use distilled water, in the West. So those are some thoughts. I hope I did answer your question, Peter.
Yes, you did. You did. Thank you.
Thank you, Peter. Sashi?
Shashi, you raised your hand. Do you want to ask the question now? I did see one more hand raised, but on the sides, Doc, I'm getting a couple of more questions. So let me start with that. Varun Bopana has asked, if one of the person has recovered, can they spend time with the remaining family members who have still not recovered?
Absolutely.
I think partly you did answer that question earlier.
Absolutely, you can spend time. In fact, you can be the caregiver for the people who are sick. I actually use the recovered patient to help the newly infected patient. It's a strategy I use because I need a right hand. I need somebody who can help me in the home because I do telemedicine. Okay, I need somebody in the home who can help me with treating the other people and helping, working with them, making sure they're not vomiting, not having diarrhea. Although the best person is somebody who's already recovered. There's no chance that the recovered person can get sick from the infected person or can infect anybody else. So I hope that answers that question. Okay.
Thanks,
there's a question, is it advisable? There's a question from Shirley. Advisable to take ivermectin as preventative for how long? I'm not in favor of using ivermectin every day. The one that my favorite is raise your vitamin D. That's your best protection. I recommend use of ivermectin only if you are at high risk. So the day I happen to see 5 or 10 patients, fresh acute COVID patients, when I say acute, within the first 5 days or 7 days, that's the night or next morning I will take an ivermectin. So far, from May to last year to now, I've had a total of 8 tablets of ivermectin. So it's not something that I would recommend or use or do anything. You do not know if you're asymptomatic. How would one know you've not taken the test? If you're asymptomatic, the only way you'll know is at the end of 1 month when I suggest you do the COVID antibody blood test. You'll be surprised at how many family members are COVID antibody positive. Because viral load may be less, you are ending up building antibodies and you're antibody positive. It doesn't matter. Okay. Is it safe to travel by air within India? Absolutely safe to travel by air. You just got to take your own protection. Make sure you're double mask. You don't need to wear the face shield. You don't need to wear the PPE kit. Just make sure you're double masked and you're not being infected by anybody around you. Alam Shetty Lakshmi, do I need to get a prescription for the antibody test? You want one? You can always come to me. I'll do it for you, Lakshmi. Absolutely can do it for you. Can get it done for you. Can give you a prescription for it. Usually, any lab, ThyroCare will do it. Any ThyroCare lab, anybody will do a COVID antibody blood test. You can actually get it done. Okay. What is the chance of catching other infections after battling COVID? What other infections? Can you get bacterial infection? Yes. If you're very heavily immunocompromised, you can get urinary infection. Yes. You need to drink enough water. But COVID, can you get another infection for COVID? The answer, in my view, is currently no. Okay. And again, that depends on what experience we go forward. Is diarrhea a post-COVID recovery symptom? Diarrhea is a COVID symptom, a post-COVID symptom, or a long-haul symptom. I've known of a patient who literally had peritonitis because her gut had developed holes in it, okay, due to necrosis, due to death of tissue, due to post-COVID clotting. Okay, developed holes, and she had leaks. She's still alive. She's still being treated in the US, but I do know of somebody who's had that. Can there be long-term effects of COVID on thyroid gland and blood count? Absolutely, you can have long-term effects. Thyroid gland diabetes, pancreas, name any gland, you can have long-term problems. The longest I've treated patients with my treatment has been 6 months, 5 months post-COVID and 1 month pre-COVID. COVID. Okay, that's the longest. Usually by end of 3 months, most patients are there, all their enzymes are down, liver enzyme, heart enzyme, LDH, CRP, everything is down to almost normal. Yeah, there are some tolerable levels. I use on both sides, I use some levels which are what I call, tolerance levels, not fixed with what numbers the lab gives me. There's always a tolerance which we say is normal. Okay. Actually, some other questions. They're moving. The questions are going pretty fast, so I can't read them.
A number of questions, and yeah, it's a little difficult at times to keep it track. But a common question that's coming again and again, Doc, is what are those symptoms to really watch out for? When do I start believing that I need to act? What can I do that?
Any symptom that you think or you thought was viral fever, was flu, was backache or pain just by overexerting, nose block, allergy. I get the standard answer saying, I have an allergy, it's a seasonal allergy, my nose is blocked. Turns out to be COVID. I tell them, take it for COVID, treat it for COVID, move on. Diarrhea, nausea and vomiting. Okay, skin. I've had a lot of skin issues. I get these big blotches, red marks, which look like allergies on the hand and the legs. That's called skin manifestation of COVID. It's an easy thing to treat. It's a very easy disease to treat if you can recognize it in time and treat the person in time. I tell people, don't trust me, go to Google, type in skin manifestation of COVID, look at the pictures, match it, and come back to me. Within an hour, they're back to me saying, sir, you're right. But that's it. Okay. The first time I saw that was challenging. After that, I learned how to do it. I'm seeing new things. I'm seeing ulcers in the mouth. Okay, holes in the mouth, really big ulcer. I'm seeing tonsils which are large, bigger than large grapes. Large red tonsils I'm seeing. Okay, and those tend to get prolonged. They stay longer than what they should. So I still have a patient who 2 months now is still having the tonsil. Finally, I've told her, I would want you to go and have the tonsillectomy done to get rid of that, because I think your tonsils are too far gone. Okay. So yes, I'm seeing a lot of things. Red blood dots in the spit. Patient is COVID positive. Understand that COVID is a microvascular clotting disease in the throat. Okay, like we have the skin. Okay, we have a mucous membrane inside us. That mucous membrane, 2 layers below that, there are arteries, veins, nerve endings, all in that 2 layers below. That 2 layers below is what can necrose, can die due to blood clotting. Okay, so you can get bleeding from those unstable clots, and it can show up in your spit. Okay, so that's common. Started getting pain, one leg, hip to upper. I actually had a patient who had multiple fractures at the age of 90. The guy was 78. You know what his post-COVID complaint was? He had intolerable pain in his joints. And when we traced it down, he had it literally on every part where he had his fracture. So literally, we had to do x-rays of his legs to see when he had the fractures, what fractures. I had to get a specialized orthopedic surgeon who focused on that and kind of found out that his inflammation had grown at the level where he had the healing of the bone that had cracked when he was 19 years old. Okay, so interesting. Can vaccine also cause clotting? Probably not. Good question. I'll give you data now to answer that question. When I looked at the clotting in Europe, okay, out of 18 million vaccination doses, there were 32 incidents of clotting. The same population, they should have had 500 clotting DVT, deep vein thrombosis clotting of unknown origin. 32 versus 500, 32 versus 18 million. It's a rounding error. It doesn't matter. Okay. If I was a finance guy, that's a rounding error. Ashish and I will agree on one thing. Rounding error, move on. It doesn't affect. Okay. So let's talk about It's going. The question are really moving fast. I can't keep up with the question.
Doc, you have one question that has come in multiple forms. The precautions, more importantly, around kids. Do you let them go out, play wherever they have to play? What precautions you need to take around them? Because obviously 2 years inside has been fairly difficult for some of the folks also. And the other piece, which possibly you and I also thought about, was the fact around the impact of it on their mental well-being as well. Can you cover these two?
For kids, I tell people, take your kids, go down, play with them outside, take them to the garden, give them some sunlight, do it in the morning, do it in the evening, do it when there are not many other kids or not many other people around. Try and space it out. You want to keep your social distancing. Kids cannot maintain social distance between their friends. So if a friend does have an infection, your kid is going to get it. Okay, like I said earlier, children getting COVID is an easy thing. They will not get a bad attack of COVID. I haven't heard or seen a kiddo die of COVID in this country, at least. I've never heard or seen a child die of COVID still. Okay, most kids who I treat kids all the time as part of the family. Most kids recover very fast. Within 3 days or 4 days or 5 days, they're back to normal, full health, eating well, thriving. They have no problem. Okay? So, yeah, taking paracetamol. I honestly don't recommend paracetamol even during COVID, unless your temperature is 100 or more. Paracetamol, if taken round the clock, tends to depress the production of glutathione, which is required for cellular function. So please do not overdo paracetamol in COVID. Okay, take paracetamol for fever post-COVID. Will it affect the vaccination effect? No, it'll be there to reduce the body pain, reduce the fever. Don't take anything else. Paracetamol is safest for when you have the vaccine and you have problems. Take that for 2 days. You won't have a problem. Okay. Somebody said, I'm on blood thinner, medication recommended in hospital, another 22-day post-hospital discharge. Worried about it, can't figure out what's wrong. I haven't really understood the question here. You're on a blood thinner recommended by the doctor at the hospital for another 22 days post-hospital discharge. What were you discharged for? What were you in hospital for? Were you for COVID or non-COVID? If you were there for a heart attack, then take your blood thinner. If you were there for COVID, I give people blood thinners. When I say blood thinner, I talk about anti-clotting drugs like clopidogrel, not ecosprin, not aspirin. I give them for either 15 days or 30 days based on my initial assessment as to how clotting, how badly can this patient clot up. So I go very aggressive if I need. And again, it all depends on the individual clinical judgment I make. Is COVID an airborne disease? It's not a mosquito. COVID is an airborne disease, but it's not a mosquito. It doesn't fly around biting you. It doesn't fly around coming in, sitting on you like flies do. COVID is transmitted face to face between you and me, between all groups of people. It's not an airborne disease like what we would think of in the past. Okay. What's the other question? I'm trying to read fast while I answer.
We have Dr. Luthra also with a question. Dr. Luthra, do you want to ask your question now?
Good evening, sir.
Good evening, Dr. Luthra.
First of all, thank you very much, sir, for your kind advice. My son is now fit and fine. My question is, sir, that due to some reason where I stay, I could not get this medicine on time, like from the market. Goronil 0.5 milligram.
Oh.
Now it's available to me.
Goutnil or Zycon?
Goutnil.
Yes, sir. Goronil. Gutinil, sir. Gutinil.
Yes. The pharmaceutical name is colchicine. The pharmaceutical name is colchicine. It's a fantastic anti-inflammatory drug. Was used in COVID, used in gout, in the acute exacerbation of gout. When I did my research last year, January, February, March, April, May, before I started treatment and zeroed on this, I was looking for a drug that gave me things that tocilizumab. There's a drug called tocilizumab, which is 45,000 rupees a dose. So I was looking for something similar to that to reduce interleukin 6, to reduce interleukin 1A, 1B. I found that in colchicine or gout mill or zycolchicine. That's why I went with that as being my primary drug of choice for COVID. Yeah, Dr. Luther.
Sir, actually, today is like 16th day of his starting of the fever. Now it's available to me. Should I give it for, like, when you prescribe me for 30 days. Like, it's now 15 days past, 16 days past earlier. Can I start it now, or should I now wait and watch the symptoms?
Dr. Luther, this is a personal question. You and I should talk offline on that, number one. I'll give you a general answer. I'll give you a general answer to everybody. Post-COVID, post 14 days, I always insist on treatment right up to 30 days, sometimes up to 60 days, sometimes up to 90 days, sometimes as much as 180 days. Because I do not want your family members, my patients to have long-term COVID. So I do treat for a long time. I know what to expect. I know how to treat. Don't second guess what I say, because I do not want you to have long-term issues. Okay, so Dr. Luthraji, you and I should talk offline on specific case. Okay.
Okay. Thank you very much, sir. Thank you very much for your advice.
Thank you, sir. There's a question about vaccination and why do people get infected after first dose or second dose? Okay. The issue we have with vaccination is it's been oversold as being the best thing since sliced bread. Okay. Vaccination is good to have. So when somebody gets the first vaccine, they put out these pictures on Facebook. They feel like they are Superman and Spider-Man. They think they can fly. They think they can jump out of the window and they land properly. So they lose sense of control on the discipline they had when they met with people. They start going out, they start meeting people, they start shopping around. That is the source of infection. Nothing to do with the vaccine, nothing to do with the reduction of immunity. I know the question behind the question is, does vaccine reduce immunity? The answer is no. The problem we have is people lose the discipline, the sense of control of their discipline. They lose that habit of looking after themselves. That's been the reason for why I see patients come exactly 7 days after their dose of vaccine when they get infected. Make sense?
Doc, this is a question which is, there are two questions that came of the same kind, and this is more coming from pet lovers. And you can expect what kind of a question I'm going to be asking. The question is, can animals be carriers, or alternatively, can human infect the pets as well?
Okay. Let me answer the question with a little bit of history. Last year, we had heard some stories out of Hong Kong that certain pets, dogs, were affected by COVID and all that stuff. I've never heard that story again, ever. Okay, never heard that story again. Never heard stories of dogs and cats being infected by humans or being carriers of infection. So my answer is, respectfully, I don't know. But the data that I've read, the material I've read, I've not seen that confirmed with other anecdotes or other stories or other things that people say. So my honest answer is, I don't know. My guess is, and I'm going to give you a speculative guess, that pets probably don't get infected from us. They may be infected, but they get infected and they show different signs. But I've never seen. I'm not a vet. I treat human beings, so I really can't answer that question in a very highly educated manner. Okay.
Right. So you can take your kids out, take them out for a walk, take all the precautions. Might as well carry your pets along. Doc, the next question: when to go for CT scan after getting infected?
Great question. Here's my practice now versus my practice last year. When I first started, the first 500 cases, I would ask for all series of blood tests, X-ray chest or CT scan, depending on what date you are. Okay. You came to me day 7, I asked for a whole bunch of things. Today, clinically, I can make that judgment call that you have COVID and I'm going to treat you for COVID. So I don't ask you for blood tests. Okay. Only if you are unstable, your oxygen reading is up and down, it's dropping, I may ask you on day 7, 8, 9, or 10 for a CT scan to understand what is the severity of the spore we are dealing with. Because depending on the severity of the spore that you have in the lungs, my